Your Dog's Friend is a nonprofit 501c3 whose mission is to help keep dogs out of shelters by educating and supporting their humans. We promote positive method of training and behavior modification through stress-free methods. As part of that mission, we offer free webinars like the one you're about to watch. Subjects range from dog behavior, stress-free training, and other tools to help you understand your relationship with your dog. If you like the webinar, be sure to give us a thumbs up. Click the notification bell and subscribe to our channel. By subscribing, you'll be notified when future videos are posted. Now enjoy the webinar.
Welcome to today's webinar, Does My Dog Need a Veterinary Behaviorist? Sponsored by Your Dog's Friend, a nonprofit 501c3 whose mission is to help keep dogs out of shelters by educating and supporting their humans. Since 2006, we've been promoting the use of positive dog training methods by hosting free webinars like this one, posting valuable resources on our website, offering affordable training classes in person and online, and providing free advice and referrals. We are passionate about our mission, so hope that you will enjoy this webinar and spread the word about Your Dog's Friend. My name is Carrie Hoare, and I'm a volunteer with Your Dog's Friend, and I'll be your host for today's webinar. Our speaker today is Dr. Meaghan Ropski. Following graduation from the Ohio State University College of Veterinary Medicine, Dr. Ropski completed a rotating internship at Friendship Hospital for Animals in Washington, D.C., where she continued to work in the emergency surgery department. However, after completing the Fear-Free Elite certification, Dr. Ropski decided that her real interest was in helping pets overcome their behavior challenges. She did a clinical behavior residency with Dr. Amy Pike at the Animal Behavior Wellness Center, and then returned to Friendship to start a behavior service.
Thanks, Carrie, for that great introduction. Hi, everyone. So happy to be here with you all today. As Carrie said, we know what our topic is today. Does my dog need a veterinary behaviorist? And what do they do? What are they? Let's get started. So welcome, you've made it here. This means that you either have a dog with behavior concerns or are looking to learn more about what a veterinary behaviorist does. Maybe your primary care veterinarian has recommended a veterinary behaviorist. Maybe your trainer or your certified behavior consultant has recommended a veterinary behaviorist, or maybe you're just wanting to learn more about veterinary behavior in general. This is a great place to start learning about what a veterinary behaviorist is, how they're different from your primary care veterinarian, a trainer, or a behavior consultant, what exactly it is that we do, what behavior concerns we can help with, how to find one, and then what working with one feels like. So we'll start off with an overview and some basic definitions, and then we'll move more towards what an appointment feels like with my team, knowing that every veterinary behaviorist has a slightly different setup, different team members to help everyone to be successful. And then we'll consider what a treatment plan and follow-up can look like when you work with a veterinary behaviorist. So where do we start? I pulled a couple of images from a fair number of different groups related to behavior. This is certainly not an all-encompassing list, but it gives us an idea of how many folks are out there that can certainly work with you and any pet that has behavior concerns. We do have to think about the different sides of behavior. We can think about the veterinary side, which is where my fellow behaviorists, and primary care veterinarians fall into play. Then we can also think about the training side of things. So I come into play there. We also have trainers and behavior consultants that fall into those categories. So let's take a bit of a deeper dive into these different aspects of behavior and behavior concerns. When we think about the veterinary side of behavior, any veterinary behaviorist is first and foremost a veterinarian. So our education, we all have some sort of bachelor's degree or associate's degree from an accredited college. So that's usually 4 years. Then we have our veterinary degree that is another 4 years. Then, to get into a behavior residency, one has to have completed a rotating internship. That is a 1-year internship with likely a specialty hospital or a veterinary hospital associated with a veterinary school, where you spend 1 year learning additional knowledge about various different specialties and applying that knowledge after you've already become a doctor. Then after that, we have a residency, and then we have a national certifying board exam. Once certified, we have the letters DACVB after our veterinary degree. That stands for Diplomat of the American College of Veterinary Behaviorists. When we think about what a veterinary behaviorist is, I like to think about them in a couple of different categories. So a veterinarian, a researcher, and a liaison. So as a veterinarian, we diagnose and treat medical concerns. We certainly diagnose behavior concerns. We prescribe psychotropic medications, and we provide treatment for behavior concerns. This includes safety considerations, environmental management, behavior modification, and training. We are also researchers. So every DACVB has a research study that we have published in a journal, and some continue to publish research throughout their career. I also think of us as a liaison. So we're promoting communication and relationship building between animals, their pet parents, veterinarians, trainers, and behavior consultants so that we can achieve the best possible outcome. One might ask, what exactly does a residency in behavior entail? So remember, this is a veterinarian that's pursuing additional behavior knowledge and credentialing beyond their vet school, beyond an internship. Residency programs are completed either at a veterinary school or through a private practice, and that individual is mentored by one or more DACVBs throughout their residency. We have extensive study in animal behavior that includes required textbook and journal article reading, various graduate level courses, and behavior modification and training courses. To qualify to sit for your board exam, you have to be supervised on at least 400 behavior cases. That's the minimum. I think I hit about 1,000 cases during my residency, so certainly depends on the residency there. We also are required to author a scientific paper that's published in a peer-reviewed journal that is of our own research and of our own design. We also are required to submit behavior cases to a peer-reviewed journal. So we have to write up and present on one of the cases that we've seen, history, outcome, what that treatment plan was. And then once all of that's done, we have to pass a 2-day, 12-hour comprehensive board examination on all animal species. So I primarily treat dogs and cats, but to pass my board exam, I had to know things about cows, horses, parrots, small animals, even say rabbits, goats, sheep, you name it, we had to know something about it. We also have to think about the different terminology that comes with veterinary behavior. So you have a veterinary behaviorist versus a resident versus what we call practice limited to behavior. So a DACVB or veterinary behaviorist has completed their residency and passed that national board certifying exam. A resident is still in their residency, has not passed their board exam yet, and they're under the supervision of a boarded diplomat. Practice limited to behavior means that an individual has completed the residency requirements. They're eligible to sit for the board exam, but they just haven't passed it yet. They might not be under the supervision of their DACVB mentors, and they might have branched out on their own. Then we get to this big question of how is that different from my primary care veterinarian? Can we both diagnose and treat medical concerns? Yes, definitely. We have all gone to veterinary school. We all have that knowledge. Can we diagnose behavior concerns? Possibly. Likely a primary care veterinarian's knowledge level doesn't compare to that of a DACVB, but can we both diagnose those behavior concerns? Probably. Can we both prescribe psychotropic medications? Definitely. Myself or your primary care veterinarian, we can prescribe medications, but a primary care veterinarian's knowledge level doesn't compare to that of a DACVB. Can each of us provide treatment for behavior concerns? Yes, it's possible, but again, it's that additional knowledge level that a DACVB has that our primary care veterinarians might not have. I usually think of this as when your primary care physician says, please follow up with the orthopedist or the oncologist or the dermatologist. Think of a DACVB as the next step beyond behavior and mental health knowledge of your primary care veterinarian. Any veterinarian can prescribe medication, but not all veterinarians know what medication should be used when, what medication should not be used in this specific case, how medications work with each other, and this is a big one, where to go if a medication fails or has side effects. Your primary care veterinarian is a great place to start for any and all behavior concerns. They might have some knowledge about behavior. Might they have a class in veterinary school? Might they have had access to a boarded behaviorist while they were in veterinary school? Maybe they've taken additional continuing education in behavior because they want to know more about it. Maybe they themselves have a training certification. They will have much of that general knowledge to start you on the road to success, but they might not have that more detailed knowledge of behavior, or this is another thing, they might not have the time allotted in their schedule to manage a complicated behavior concern. Some primary care veterinarians are not comfortable prescribing psychotropic medications, and they refer to a DACVB right away. That's completely fine and fair. I will usually joke that my dog and cat have a dermatologist for a reason. Nobody wants me treating a primary skin disease or an ear infection. I have other folks that know how to do that and know the most up-to-date knowledge. And that's completely fine and fair. Some primary care veterinarians are comfortable prescribing psychotropic medications, but they might be comfortable with what we might think of as the first line of defense medication, but might refer to a behaviorist if that's not a good fit for the dog. Some might refer any complicated behavior case to a boarded veterinary behaviorist. This might be multiple behavior concerns, lack of response to an initial medication. Maybe there's a complicated environmental management that's needed. Maybe we're talking about challenging conversations with that pet parent or even a euthanasia discussion. Those are all reasons why a primary care veterinarian might refer to a boarded behaviorist. The next thing that I want to touch on is fear-free. So we heard in my introduction that fear-free elite certification. What exactly does that mean? This is a certification or additional education for veterinary professionals, various pet professionals, animal welfare communities, and pet parents. A fear-free veterinarian has more knowledge about behavior and emotional well-being of their patients and their pet parents. This is available to any veterinarian. Anyone can be fear-free certified. A fear-free certified veterinarian understands the impact of stress and anxiety, how to identify and decrease that stress and anxiety, and they're able to provide a better veterinary experience for the pet and the pet parent. What's great though is fear-free doesn't stop at the veterinarian. Veterinary technicians, client service representatives, veterinary practice managers, even your trainers, groomers, pet sitters, boarding and daycare professionals can all be fear-free certified. These can be major assets when managing a pet with behavior concerns. Fear-free also doesn't stop at the individual. An entire veterinary practice can be fear-free certified. This means that 100% of the team members are fear-free certified, and the practice has standards of workflow and operations to implement those fear-free practices. They have online and virtual assessments that are performed so that they conform to that high standard, and renewal is every 3 years to ensure that that standard is maintained. The fear-free topic helps us transition to the world beyond the veterinarian. Whether we're talking about a veterinarian or a DACVB, these professionals have the medical knowledge beyond the groups that we might talk about next. Within these next groups, there might be veterinarians that are members of these groups, and they might have additional certifications, but they don't have to be. Often, these next set of individuals are not always veterinarians. We have the American Veterinary Society of Animal Behavior. So these are veterinarians, veterinary technicians, maybe doctorate level animal behaviorists and research professionals. They have a shared understanding and interest of animal behavior and treating those behavior problems. They provide science-based education to the membership. They have various position statements on common behavior controversies and problems, and they have a commitment to improving the quality of life for all animals and thus strengthening that bond between animals and their caregivers. The position statements that this group has that are available through their website to anyone are ones on humane dog training, positive vet visits, a statement on dominance, puppy socialization, and even breed-specific legislation. Another group that we have out there is the International Association of Animal Behavior Consultants. So this is trainers, behavior consultants, behaviorists, shelters, maybe rescue workers, the veterinary community, and researchers. They, as a group, elevate behavior consulting and training through evidence-based education and professional development. So think continuing education, furthering that knowledge, and they adhere to ethical standards and use the least intrusive, minimally invasive practices. These are credentialed members, so they've received endorsements from other behavior professionals, they've completed case series, and they've passed an examination to demonstrate their knowledge and how to apply principles of behavior change. One might say, that's all interesting, Dr. Ropski, but what about trainers? I will say pause there, because technically anyone can call themselves a dog trainer and can use whatever techniques they choose to implement in training. Currently, there's not a licensing requirement or mandatory education or certification requirements to become a dog trainer. Those with additional training will have credentials indicating those certifications following their name, but it doesn't necessarily guarantee they use force-free methods or avoid punishment, punitive, or aversive-based techniques. Gosh, this puts a lot of pressure on you as a pet parent to pick a professional who will meet your needs and meet those needs in a humane and safe way for your pet. While this is not a presentation that talks about those various different types of trainers or what types of trainers are out there, there are certainly resources on this topic, and I'd encourage you to explore those further if you have those additional questions. I'll stop on this one slide before we move on to that next topic to say, how can we find a trainer that's going to use those positive reinforcement and force-free techniques? You've got a couple of resources here through the DACVB website. So that's the Behavior College's website. They have a drop-down menu and a category that says training and how to select a dog trainer. That brings up a PDF with additional information. You can also go to the AVSAB website. They have an uploaded document that is called How to Choose a Dog Trainer. You can actually find that through your search engine of choice as well. And then Your Dog's Friend has a wealth of resources specifically in the DMV. So main screen, you're looking at resources, and then you've got a drop-down menu of all of the different resources that are out there. If you look under Positive Trainers and Veterinary Behaviorists, you'll find my information and the behaviorists in the DMV there as well. Gosh, now that we've gone through all of that information, how do we choose what type of professional you might need? I want to use at least this thought of how do we choose what professional that we need. So we're looking at three images here. We've got a little dachshund that's in their own personal life jacket. Then in the middle image, we've got a couple of dogs on a life raft. And then in the last image, we've got some men with dogs on a big boat. So think of these as each of your different levels of behavior folks that can help you to be successful. I would think of your trainers as someone who can throw you a life vest. They are potentially going to be working individually with you, maybe in a group class. They can help for a wide range of behavior-associated questions, concerns. Maybe that's some basic obedience. Maybe that's house training. Maybe that's some behavior concerns. They are likely your first line of defense. Some can even work through more complicated behavior concerns and know when to refer to your veterinarian or your veterinary behaviorist. Think of that second image, that life raft, as your primary care vet. They are going to have maybe some training knowledge, but they can certainly provide guidance on working up those medical concerns, maybe even working up some behavior concerns as well. They certainly know when to refer to a veterinary behaviorist. Now, think of me as that last picture, that boat coming to save the day for a bigger behavior concern. Can I do everything that a trainer and a veterinarian can do? Sure thing. We are coming to me for those bigger behavior concerns. We're looking for medication guidance beyond your primary care veterinarian. And that's also a place where I can provide referrals to maybe other specialists to help us to figure out what's going on. Then you get to that question of, when is it a training problem or a behavior problem? Meaning, when do I need a trainer versus a veterinary behaviorist? It can get a bit sticky because there can certainly be some overlap. A veterinary behaviorist is going to incorporate training and behavior modification into any treatment plan. A trainer is also going to provide you with training to manage the concerns that you raise. I would say one of the biggest differences is a trainer cannot or should not be recommending specific medication. They can recommend that you see a veterinary behaviorist or talk to your veterinarian should they plateau in training or not be progressing, but they're not ones that should say, you should use this medication. They should tell you to go and talk to your veterinary professional of choice. Where are those spaces where your trainer can be your first line of defense? Certainly when we're trying to learn new skills and behaviors, maybe even puppy socialization and exposure to new things in a safe manner. Think of your basic foundational behaviors: sit, down, stay, recall, and the like. Leash walking, maybe management of naughty behaviors. And I put that in quotes because if a dog doesn't know what's expected of them, we might see it as naughty, but we have to be mindful that they might just not know what we want. That could be jumping up, barking, chewing, house training, alone time, or crate training. Maybe we need help with child and family management around a dog. Maybe we're welcoming a child into the home, or maybe we're even preparing for travel. Now think of the differences between when it's a medical problem or a behavior problem, meaning when do I talk to my primary care vet versus a veterinary behaviorist? These items overlap so frequently. Your primary care veterinarian should be your first line of defense to rule out a medical problem. Some of them are great at this, and some have less experience. A veterinary behaviorist is trained to do both, being a veterinarian first and a behaviorist second. A veterinary behaviorist might ask you to return to your primary care vet or another specialist for additional testing should they suspect that there is a primary medical concern. Big overarching question that I typically get is, what kind of behavior concerns do I or any other veterinary behaviorist manage? Fear, anxiety, aggression, phobias, leash reactivity. That can look like a great many different things. Are we showing aggression to people, other dogs, strangers, those types of things? Comorbidities, meaning multiple behavior concerns or behavior concerns that are complicated by other medical factors. Maybe you have a baby on the way. Maybe we have a puppy with behavior concerns. Are there children that are at risk? Is this dog at risk for euthanasia? Has it already been talked about? Has the pet parent expressed concern about that topic? Maybe we're thinking about veterinary visit fear or phobia. Now that you know what type of behavior concerns I can manage, you've decided you want to meet with a veterinary behaviorist. Well, now what? You can go to the website for the American College of Veterinary Behaviorists. We have a diplomat directory, and you can go to Find a Diplomat, This is directly from that website, these little screenshots. So you can either use a search radius to say, this is how far I'm able to drive to find a behaviorist, or you might have a specific behaviorist that you want to work with, or a certain location that you are searching for. Remember, there's about 100 of us in the US and Canada right now. So you might ask, what if there isn't a DACVB near me? Does that mean I don't have the ability to access a behaviorist? Well, you might be in luck. There might be a resident near you. They're not listed in our diplomat directory because they're not officially boarded yet. They haven't passed their board exam, but they might be a great option for those without a boarded diplomat in their immediate area. There are also some behaviorists who will perform virtual consultations. It really all depends on what their license allows them to do. They might be able to work with you directly, or they might be able to work with your primary care veterinarian in consultation where they make recommendations and your primary care veterinarian carries them out. You can certainly contact the ACVB through our website for this information. Now, you found me. What happens next? We're going to want to get a little bit more information about you, your pet, the household, what your concerns are, what training you've done. Are there any medical concerns I should be notified of? Have they had any response to medication if they've already used it? And what are your goals in coming to visit me? The next couple of slides, we're going to look at what my space looks like and talk about what an appointment looks like with me. This is the inside of my space, and the picture in the middle is showing you all the sign that is on my front door that says, stop, do not enter, do not knock. I make sure that my pet parents are waiting in the car and call us from the car so that we can escort each and every pet safely into our space. You can imagine pets with behavior concerns, certainly aggression. We don't want two aggressive dogs meeting each other in the hallway. That would be pretty scary for those pets and those pet parents. So every single person is escorted personally into my space. I have a pretty big exam room so that if dogs are uncomfortable being close to me or my staff members, they have enough space to be as far away as they're comfortable. I've got a nice couch for my pet parents to sit on, a nice comfy bed for my pets to rest on, and then certainly space for myself and my assistants to be in on these appointments with me. I do have a little bit of a video of what it looks like to come and enter my space. So as we're walking towards that door, we'll see that little sign in that center window. If you are coming to visit me, that door will be wide open for you so that you can walk right in. You walk into my space, not meeting any other dogs. We go to the first room on the left. We've got the couch that my pet parents sit on. We have my desk, a nice bay window, and my vet assist's desk. That window has window film on it, so there aren't any triggers that my pets have to be worried about. And you can see there's a great amount of space so that nobody is crowded or feels uncomfortable. What should you all expect from an initial appointment with my team? It's about an hour and a half. We discuss your pet's history so that I can form a treatment plan. That includes safety, environmental management, medications, supplements, training and behavior modification options. I certainly provide referrals, whether that's either to my team, my in-house training team, or to a trainer in your home, maybe even group classes. And then we schedule our first recheck. Now, for any of our dog friends that are watching, you might say, Dr. Ropski, what am I going to do the whole time? An hour and a half seems like a long time for me to sit. Are there snacks? Don't worry, we've got snacks galore. So we've got snacks, we've got enrichment items. An hour and a half can be a long time for our pets to be able to focus. So we definitely have a lot in our arsenal to keep them busy. Phew. My pets might say, we wouldn't want to be bored while you're talking to our parents. Don't worry, I've got you covered. What are we going to talk about and why? So important to get information on all of these different aspects so that I can help to formulate the best treatment plan for you and for your pet, because everybody's household is different. I'm going to be asking you about your dog. We're going to talk about age, sex, and neuter status. Certain behavior problems are more likely to present at certain ages. Periods of development can point to a different reason as to maybe why a behavior is occurring. Age might point me towards how successful we might be to affect behavior change. When and how you acquired your dog might point me to early life history, and that could point me in a direction of some behavior concerns, what they did or did not encounter, and when. When we think about household composition, who lives in the home? How do they interact with this dog? Are there children in the home that might make management more challenging? Are there non-resident family members in the home? Think of visiting relatives, people that may help out in the home, or maybe roommates. What type of home do you live in? Is there a yard? How do they get their exercise? Then we talk about concerning behaviors. I have my pet parents order the behaviors in the most concerning so that we spend the most time on it to least concerning, knowing that we might not get to every behavior concern discussion depending upon how many there are. I ask my pet parents to describe that concern. When did it start? What context does it happen in? How often does it happen? What is your pet's body language when it is happening? What's already been tried to manage, treat, correct that behavior? Have there been any changes in the household that might point to that behavior concern? I ask for some recent examples. Then I ask what your reaction is as a pet parent, and is this concern getting worse, better, or staying about the same? Then we talk about what daily life looks like for your dog. What food are they eating? How much? How are they fed? This gives me an idea of, are they getting enough nutrients? Could protein content have an effect on their behavior? Are they eating all of their food? Are they getting mental enrichment? Is there any guarding behavior related to food? And then, are there any changes in eating, drinking, how much they're sleeping, and elimination habits? Then we talk about medications and supplements. So what are they taking now? What is their response? Have they had any negative reactions in the past? Then I ask, what have they taken in the past for this behavior concern? What was their response? Was there a negative reaction, and why did you stop it? Then we talk about training. Have they worked with a trainer? Have they had group classes? When did that happen? And are you currently working with anyone? What did you learn? What did your pup learn? What tools have you used? Are we using positive reinforcement or force-free techniques? Are we using treats? Maybe cues, cue words, hand signals. Maybe they know marker or clicker training. Are we using body harnesses, head harnesses? What other equipment are we using? Have we used any sort of punishment or aversive methods? This can be a choke chain, a prong collar, an electronic or shock collar, other items such as that. And then, what cues do they reliably know? This helps me to know what I can use in our treatment plan that your pup already knows and what we might need to help them to learn to be successful. Then we talk about our aggression concerns. Is there any aggression with handling, grooming, brushing, nail trims, or other husbandry procedures? Is there any aggression with petting, hugging, snuggling, cuddling? Is there aggression when your dog is disturbed from resting? Is there aggression with discipline? Is there aggression when food or objects are taken away? Who is this aggression directed to? Family living in the home, only the children, people living outside of the home, veterinary or grooming professionals. Then I want to know what your dog's response is to specific triggers. So when we think about visitors or strangers, how does your dog respond to the doorbell or knocking? How do they respond to frequent or known visitors versus strangers? Is there a difference between, say, male or female strangers? Is there a difference with children? Is this the same inside the home versus outside of the home? Then we talk about our dog's response to other dogs. So dogs outside the house, on leash versus off. We think about dogs inside the home, on leash or confined in some fashion versus free in the home. I have a couple of miscellaneous items. So is there any chewing, licking, biting of themselves? Is there any licking of other surfaces? How do they react to thunderstorms? How do they react to fireworks? How do they react to other environmental noises? How do they react when you leave the home? Is there any sort of chasing, attacking lights or shadows? Is there any tail chasing or snapping at the air? Then we get to the most challenging questions that I ask. I ask what my pet parents think about and how they feel about these behaviors. I ask what your goals are. And then I ask, under what circumstances would you consider rehoming this dog? Under what circumstances would you consider relinquishing this dog to a shelter or a rescue? And then under what circumstances would you consider euthanizing this dog? I understand that these are three really hard questions for my pet parents to answer. But as you can imagine, everyone comes into my appointment at a different space in their dog's or even their mental health journey. These are some difficult questions to ask, but it helps me understand what our potential treatment routes might or might not be. During the appointment, I'm also assessing for any medical concerns. Medical concerns left untreated can make it very difficult to manage behavior. Medical concerns or pain can cause aggression, anxiety, and fear. They can also cause irritability or a shorter fuse. That can look like itching, licking, GI signs, maybe even a lameness. We need to rule these out or treat these as we are managing the primary behavior concern. Then we form a treatment plan that includes a safety plan, environmental modification, potentially some medications, behavior modification and training and enrichment. Remember, this varies based on diagnosis and what the family is able to do. Some folks come in and say, Dr. Ropski, I am ready to do everything that you need me to do. Others might say, Dr. Ropski, my time is a bit more limited. Give me one or two things that I can do really well to help my dog be successful. When we think about a safety plan, this could look like barriers in the home, say gates or exercise pens or crates. It can look like management of visitors or people entering the home. It can look like basket muzzle training. Maybe we're modifying walk strategies, so avoiding certain times of the day, certain routes, or alternate exits to buildings. This is really helpful for a lot of my apartment living dogs. Might we also talk about walking strategies? So a U-turn, a turn and go, using a car as a visual barrier, and maybe even how to safely break up a dog fight. We think about environmental management. I talk about opaque window film often. It is very helpful to block that visual stimulus. Think of those dogs that are watching out that window for all of those triggers. Think about white noise, brown noise, or classical music to decrease a sound stimulus. We might use felt or acoustic panels to decrease a sound stimulus, really helpful for apartment living. We might use gates to manage where your dog can and cannot access in the home. Might we think about general arrangement of the home and furniture? Think of this as a sofa that's sitting by the window that lets a dog monitor what's happening outside. And maybe we need to move this so that dog does not have to sit on watchdog duty. We might think about areas that they can rest during high stress times of the day, safe departure areas, or even carpeting on slick surfaces. This next video is going to show in a time lapse what applying window film looks like. This is my husband and I putting up window film in his shop area. So you can see how opaque that is, but when the sun is shining, light comes straight through. Right now where I'm presenting, there's a window straight in front of me. It has opaque window film and it's at a bright portion of the day where I know the sun would be shining right in my eyes, but the window film dilutes that a bit. This next video is going to show the benefit of, say, carpeting slick surfaces. This is Sadie and myself in our home. So these are our stairs that are hardwood. They used to not have carpet squares on them, but you can see they have carpeted surfaces now. You can see how she is stretching her little body to get those treats. She was afraid of the slick surfaces of those stairs because she has some hip problems. She slipped down the stairs a couple of times and at one point refused to go up the stairs. Steve had to carry her 70 pounds up and down the stairs for a couple of days because she was so afraid. So we applied carpet squares to those stairs to give her a bit more surer footing so she felt safe going up and down the stairs. You can see this last time she resets herself. I step away and she says, Mom, I can do it. She goes straight to the top of those stairs and look at how excited we both are. She's so much more comfortable because she has surer footing on those stairs. And when I step out of the way, look at that brave girl coming down those stairs. She says, yes, mommy, I can definitely do it now. We also think about how medications can be beneficial for our pets. Many dogs benefit from medication to manage their fear, anxiety, and stress, and even aggression. Our goal in using medication is to decrease the intensity of a behavior, to decrease the frequency that a behavior happens, and to improve the recovery time after a behavior occurs. So this is your return to normal. We also can work to improve the learning ability. The big questions that I get from a lot of my pet parents are what types of medications are there, what the side effects are, what safety looks like, and is this a forever type of a medication? So our types of medication include a daily medication that's given every day and takes a longer period of time to see effect. It's given regardless of whether a trigger is present. These are medications like Prozac, Zoloft, Lexapro, Effexor. Then you have your fast-acting or event medications. They are given prior to a stressor. Most commonly, this might be, say, trazodone, gabapentin. I might use a medication called clonidine. There are many different ones. When we think about side effects, they should be few and farther between. Sometimes we can see vomiting, loose stool, a lack of appetite, maybe some sleepiness, but these should be rare. I will say that I don't tolerate side effects. So if you all see side effects and you're working with me, you tell me about them and I either modify the dose, modify how we're giving the medication, or completely revamp that medication plan. We see that these are safe to use long term. They should not cause liver or kidney damage. I recommend blood work once a year to make sure that everything is working in tip-top shape, but most of the time that blood work is pretty boring, and boring is good for me. Then I get the question of, Dr. Ropski, is this a forever type of a medication? It depends. It depends on the dog, depends on the family, depends on the environment, depends upon the scenarios that they are in. I will usually say that my pet parents fall into one of two groups. Group A might be ones that say we've started a medication and their pet is doing amazing. And they might say, Dr. Ropski, I never want to stop that medication. That's the group that I'm in. Sadie gets a medication every single day so that we can better manage her general anxiety. And she also gets a medication for times of higher stress. She will be on her medication lifelong because it helps to give her the best quality of life possible. And by extension, helps us to have the best quality of life possible. Then you have folks that might fall into group B that say, Dr. Ropski, Fluffy has been doing well for 6, 9, 12 months. Can we see what they look like on a lower dose of their medication? I will always say yes with the caveat that if we decrease that dose of medication and those challenging behaviors come back, well, that tells me that your pup could really benefit from that higher dose of medication. And we go back up. I like to think about this as an idea of what might medications and various environmental management strategies do for me. A lot of times when my pet parents come and meet me, they are struggling to tread water in the deep end. They are just looking for someone to throw them that life jacket, throw them a raft, or to have the Coast Guard come and help them to survive. I think about our environmental modification plan and our safety plan as a way to bring you out of the deep end into the shallow end where your feet can touch the bottom. And your medication plan are your floaties so that you can keep your head above water to do everything that comes next. And that is behavior modification and training. You cannot do behavior modification and training if you are just treading water and barely able to stay afloat. You are not going to have the mental bandwidth to do that. So I use the other aspects of my treatment plan to give you that space to say, okay, we can do this. Behavior modification and training is a broad topic. This can range from leash walking skills and managing a reactive dog. It can be greeting visitors and having strangers in the home, maybe separation anxiety training, where you're working with a specific trainer that has additional knowledge of separation anxiety. Maybe we're doing vet visit or cooperative care training. Maybe we're working on storm or noise desensitization and counter conditioning. Maybe we need help with interacting with children, or maybe it's purely relaxation and settling. We might work to walk with a dog on a long line. So do they potentially experience frustration when being on a shorter line, and that adds to some of those more challenging behaviors? Do we convert to a long line when it's potentially safe and there are maybe not triggers that are present? If you see me or any of my clients out walking, we often look like this. We have our treat pouches ready to go. We have our long lines. That's the picture of Steve walking Sadie on her long line. I have her short line attached to me so that if we need to convert mid-walk, we certainly can. We might talk about outdoor activity management. This is us at a local brewery. Sadie has her harness on and her short leash. We have a frozen topple with delicious food items in it. She also has a cooler all to herself for additional frozen food items so that we can keep her busy. She's got her own water bowl and a blanket to sit on. You can also see we are parked at a table further away from other people, and we have an exit strategy if we need to, if she's having a hard time. We can also think about what meeting visitors or not meeting visitors looks like. So this is my home, same setup. That baby gate lives there every single day of our lives. This first video is when we have an HVAC person coming to the house. Sadie does not need to meet the HVAC person. She is safe behind a gate downstairs in our basement area. She is working on a frozen delicious something, and she does not ever meet the HVAC person. Now, however, she does want to meet our friends and our friends who have dogs and are comfortable with her. So she sits downstairs behind that baby gate. I welcome our friends in. We're going to go straight to my kitchen table. There is a treat jar that is already set and ready to go. I give our friends instructions on how to greet Sadie. You are fine to give her treats. She is fine to take treats from your hand. Ideally, we'd love to have all 4 paws on the floor. I ask them if they have any questions, depending upon how dog savvy they are, and then I go downstairs and get her. Here she comes running up to say, "Oh my gosh, I am so excited to see everybody." But look at how easy that is for them to meet her sitting down as opposed to meeting her right by the door. They're doing a great job of giving her treats, and all 4 of her pawsies are on the ground. We might talk about separation anxiety training. So do we have video cameras set up to see what our dogs look like when they are alone? Are we working with a separation anxiety specific trainer? We might also work on cooperative care for veterinary visits or for handling and husbandry at home. So think about nail trims, ear cleaning. This last picture is of a dog that is actually soaking their foot in a solution because they have some skin disease. We might also think about what a vet clinic setup looks like. This is not the hospital that I work for, but look at what a good job they did setting up Sadie for success. This was us in mid-COVID, and they have peanut butter and whipped cream ready to go. She needed a blood draw, she needed her ears looked at, and she needed vaccines. So they set her up for success having all of these delicious goodies ready for her. Might we think and talk about basket muzzle training to provide that added layer of safety and equipment to help our dogs to be successful, but also safe when they get those big feelings? For some of our dogs, we might talk about what a restraint-free blood draw looks like. This again falls under the realm of fear-free. So this is myself, my technician Kristen, and my vet assist Tia. You might recognize Kristen from the picture of her coming into my home with her husband. So here we are needing to draw blood from Sadie's back leg because she needs to have surgery. So I am at the front of her body. I am giving her some delicious peanut butter to lick. We're using it as a distraction, but I also know if she is licking that peanut butter, that gives Kristen and Tia the go-ahead to go ahead and draw that blood. So Kristen is inserting that needle into her blood vessel now. That needle is in. You can see that no one is actually restraining Sadie. Tia's hand is on her leg to apply pressure to that blood vessel, but her other arm is out of the shot. She is not holding Sadie in any way, shape, or form. Kristen has one of our blood tubes on that needle and that tubing, so we are effectively getting that blood. I am communicating with my team letting them know that Sadie is still eating. Kristen is going to switch out those tubes, and she is also communicating with me. Dr. Ropski, blood is flowing really well. Everything is going good. I am switching tubes, and then she's going to let me know that we are done. Needle is out. Sadie didn't even feel it at all. Kristen is applying pressure on that blood vessel so that we don't have any additional bleeding. Sadie is still eating. We're all admiring what a good job she's doing. We check to make sure that there's no additional bleeding. We don't have to put a Band-Aid on her leg. Everything looks good. And we say, good job, Sadie. What an awesome job you did. Take this topple and lick that peanut butter. Not every dog is able to have a fear-free and restraint-free blood draw. So then we talk about pre-visit medication plans, vaccine site training, blood draw training, injectable sedation training, and veterinary exams. Those are all things that fall under the cooperative care heading. We might also talk about what it is like to train a dog to take medication. I am going to stop talking and let you guys hear the audio from this video.
Hey, Sadie. Good job.
So that is a daily occurrence in our household. Happens twice a day, every single day. She gets a medication that is a not flavored, not delicious medication, but a human medication that sits in a little bit of wet food on a fork or a spoon. In this video, she's sitting in our kitchen, but we can call her from any room of the house to take her medication. So sometimes that can be something that is very helpful for my pet parents. We also think about enrichment. Enrichment can range from, say, food enrichment items, other mental enrichment items like playing games or doing training. Remember that food-based enrichment can certainly be your friend. Does Sadie have some food enrichment downstairs because I am on this talk? Sure thing. It helps her to be successful and also helps her brain to be busy. Before we finish up, I'll give you guys some information about myself and our team. If you are in the DMV and you are interested in scheduling with us, we see appointments Monday through Thursday. It's best to email to start that conversation. You can imagine having 1.5 hour appointments. My team and myself are very frequently in appointments. Reaching out via email lets you start that process. We have an automatic email that comes back to you as a reply and gives you information on how to start that process. There are certainly a great number of veterinary behaviorists in the DMV, and there might be veterinary behaviorists that are closer to you, certainly if you are out of state. Do use that DACVB website to find a veterinary behaviorist near you. We have finished the presentation portion. Let's certainly move on to questions.
Thank you so much, Dr. Ropski. So questions that I've found so far, I'm going to start with ones that are kind of involved, which is kind of getting the process started or terminology type things. So when trainers or people with a degree in animal behavior call themselves quote unquote behaviorists, it seems to muddy the distinction for pet parents between veterinary behaviorists and non-DMV professionals, and again, some self-described dog experts with no qualifications. Do you encounter this confusion?
I do. I find I encounter it more so when people are initially reaching out to almost say, well, my vet recommended a behaviorist. What exactly do you do? So usually I find that confusion happens in that initial email. And I find that I almost draw that distinction in there is a gamut of knowledge that's out there. Yes, you have that veterinary behaviorist that can do all of the things: medication, management, treatment plan, training, any and all of those things. You've got me and I am in your corner. And then you have those other people that can do some aspects of each one of those things. And I think the biggest thing to be mindful of is that trainer, that behavior consultant, or say someone who has a master's degree or a PhD in animal behavior, they are not able to prescribe medication. So if that's something where your dog really needs a medication to help move that needle in the direction that we want, that's where you really do need to seek that help of a veterinary behaviorist to be as successful as possible.
Excellent. Is it helpful to bring a video of certain behaviors to the appointment if you can capture it?
I will say I loved how you asked that question, if you can capture it. And that's what I say to all of my pet parents. I certainly don't need to see the behavior to be able to diagnose that behavior concern. I will usually say, you all know your pets better than I do. You will be able to do a great job describing exactly what that behavior is. And if I need additional information, I'm going to ask you about it. But if you happen to have a video of that behavior when it's occurring and you've gotten it safely, no one's been harmed in the making of this video, I am always happy to look at those videos. I also will ask sometimes to have my pet parents send videos after our first appointment. So maybe we need to see what they're looking like when we are leaving a dog with separation anxiety at home alone. Maybe we are doing some training for cooperative care or muzzle training, and we want to see what that training looks like. Set up your camera, let me see what it looks like so that we can talk about it at your next recheck. So I'm always happy to have videos as long as they're achieved in a safe way for the dog and for the humans.
Excellent. Okay, I've heard it can take a while to actually get an appointment with a vet behaviorist. How long is your current wait time, or what do you recommend for pet parents while they wait?
That's a great question. And I think it's one of the challenges with there being so few of us. There might not be a fast way to get in. So I will say currently my wait time is about a month and a half, 2 months. But we do have a wait list. So as cancellations come through, anyone that has their deposit, their history form in, they get an email from my team that says, hey, we've got an appointment available this day. First come, first serve. Who wants it? Most often or not, someone takes that. I have, and I don't know if every behaviorist has this, but I have certain appointments saved on my schedule for a emergency. Maybe it's something where a pet parent says, I cannot wait. I need to get in to see you right now. Or maybe there is, say, a baby on the way and we are in a time crunch. So I have an emergency appointment that does cost a bit more, but folks basically get to jump the line and have that emergency appointment and don't have to wait. I would say that that's pretty typical for a wait time for a behaviorist. Now, you might find that, say, folks that do virtual consults or vet to vet consults, I don't know if their wait time is less, but certainly something where you might have access to another virtual option instead of working with someone in person. Another option could be to say schedule with your veterinary behaviorist and then talk to your primary care vet and say, I am scheduled with Dr. Ropski on this day. Is there anything that we can do in the meantime? Your primary care vet might say, you know what? I'm comfortable starting you on a medication or giving you at least the beginnings of a safety or an environmental management plan. And then Dr. Ropski can modify it from there. So sometimes a primary care vet can help to jumpstart that process and give me additional data in the meantime.
So kind of along that line, is there a directory of veterinary behaviorists who will do virtual consultations?
I don't think that there is a directory that exists. We just had some emails go back and forth asking that question on our listserv, and there's a fair number of folks that do. I have a couple that I will recommend if folks are looking for that, because I know that they will practice veterinary behavior in a similar way that I do. So I know at least what I'm recommending. That's certainly something where if you needed that information, I would probably go through the ACVB website asking for that. And I mean, realistically, if you wanted that info and wanted some recommendations, you're welcome to shoot me an email. My team has that info on speed dial. So if you need it, you're also welcome to reach out to us. Happy to refer you to folks that way.
So again, along the same line, since we're there, and it's my own question from experience with my own clients. For clients who are working with their primary care vet, and they're trying to get into a veterinary behaviorist through the vet to vet consult, which some of the practices offer. Do you have any advice for pet owners who are having a hard time getting buy-in from their primary care vets to go farther down the road?
It's an all too common question that I get, unfortunately. I think that there is differing levels of comfortability in treating and managing mental health for our dogs and certainly for our humans as well. I think that there are going to be some primary care veterinarians who are never going to be comfortable with that psychotropic medication side of things. And that might be a scenario where we have to do some at least soul searching to say, if this is what my dog or cat, I know we're your dog's friend, but cats might need help too. If this is something that my trainer and I, or I myself am worried that my dog needs, is that the best primary care veterinarian for you? Because you might run into that challenging situation of, my dog is on a medication. Is my primary care vet comfortable continuing to see my pet when they are on a medication? Some are, unfortunately, some are not, or they might not be able to provide you with refills and things like that. So I think that's an appropriate question to ask your primary care veterinarian. I might phrase it in such a way to say, this is something that I'm interested in pursuing. There is not a veterinary behaviorist near us. I checked. They are able to do a vet to vet consult. Is that something that you are comfortable with? And if the answer is no, do you say, is there someone else in the practice who would be comfortable working with that veterinary behaviorist? I tend to find that when my primary care vets are working with a specialist, they are pretty comfortable with, say, what our recommendations are, as long as we're sort of driving the bus in the background and we are able to say, this is what I recommend, and then they have access to us. So I think that that's probably the way that I would think about or recommend going about that conversation. I, as a behaviorist, never have a problem if a veterinarian, say, emails me. Many of them have my phone number, so they text me and ask me questions. Sometimes those are pretty easy questions to get us started, and that's at least first line of defense, especially for folks that might not be able to come and see me or might not have the finances to come and see me.
That's excellent, excellent. Let's see, how big of a financial commitment is working with a veterinary behaviorist? And a little bit related, how long can you expect to be working with a veterinary behaviorist?
Yes, both great questions. So I will say cost is going to vary based on location. So I can only speak to how much it is, at least in the DC area. So for us right now, initial appointment is about $550. So remember, that's for an hour and a half with me, and then you are going out the door with that treatment plan. And then we plan for a recheck about 4 to 6 weeks from that point in time. If we're starting medication, that's when we can check to see how that medication plan is going. And it gives you all enough time to work on all of those homework items. So with that initial recheck, we're looking at about, I think it's $250 right now, but that's another hour of in-person time with us. So at least in that regard, first appointment, second appointment, you're looking at, gosh, if I'm doing the math there, $750 to $800 or so dollars there. Again, not the same for every behaviorist that's out there. And then I will usually say rechecks after that depend upon what the needs are of the dog and the family. Some folks might say after that first recheck, Dr. Ropski, we're good to go. This plan is great. I don't need to change anything. Folks have me for a year after that first meeting, so I can continue to prescribe for that first year, and I give my clients unlimited email during that time. So usually, if it's a quick email and it's a brief question, I'll respond right back to that pretty quickly. If it is, say, multiple paragraphs, multiple questions, gonna take a bit of time and maybe information might not come across well via email, I have smaller, brief rechecks that I can do via phone or virtually that are certainly less than that initial recheck. You also have to be mindful that you're most likely working with your trainer during this time as well. So that's another added expense that might determine what that looks like for you. So certainly a greater financial commitment in that regard. But I'll tell you guys, my discharges are between 8 and 10 pages. So you are getting a ton of information after that first initial appointment. So you are walking out the door with a lot of knowledge that I share with your primary care vet and I share with your training team as well. So a little bit of information on what that looks like. Carrie, remind me, did I answer the second half of that question? Was that was timeline, wasn't it?
That was timeline. The first one was
Cost.
finding a cost, and the second one was timeline.
Okay.
Yep.
I would say as far as timeline goes, so the way that at least my license works, you meet with me, I can work with you for that next year until I have to see you again. At that year time point, some folks might say, Dr. Ropski, we are rocking and rolling. We are comfortable transferring that care back to our primary care veterinarian. You've talked to your primary care veterinarian. They've said, yes, perfectly comfortable taking on those prescriptions. I write a letter that says, this is what everything is looking like. This is what we've done so far. This is the medication that we are on. And I say, so happy that we were able to affect behavior change. Circle back in the future if you need me. So I have some folks that I only meet with for a year. I have other folks that are still doing great, rocking and rolling after a year. And they say, Dr. Ropski, I want you on standby just in case something changes. So we meet at that year time point. I get the update on how things are going, what we might need to work on in the future over the next year. And then we start that year time clock again. I have some clients that I have seen every single year for the past 5 years because they want me in their back pocket if they need me. I have other folks that might say, I just need you this one more year. And then let's see what that looks like. So there's a high level of variation depending upon what folks need or don't need. So it really does depend on what that need is for that family. And I will tell you, I am happy to do rechecks where we are doing amazingly and folks rate their dogs as a 10 out of 10. And we talk about what an awesome year y'all have had. I am also happy to have those maybe more challenging rechecks where we've got to make a major medication change or they're struggling and we need to revamp that treatment plans.
Excellent. Kind of on the financial lines, do you know if pet insurance programs, if any of those will cover veterinary behaviorist charges?
So I will say it depends. There are, I know some out there and I don't know which ones because usually my pet parents tell me, hey, you're covered. That's why we're here. So there are some that will cover it in their primary, more general policy. There are others that cover it as a rider. So for example, and not endorsing in any way, shape, or form, we have Trupanion. Our policy is not something that covers behavior in the primary policy, but it's covered in an additional rider that was underwritten into the policy when we got Sadie. So it doesn't cover her behavior concerns because they are pre-existing, but there's another aspect of the rider, which is why we have it. So for some, yes. I will also say that for some training that is sort of directed or supervised by a veterinary behaviorist might be covered. So that's why many of us have some sort of trainer on staff, because I can say, bill it under me. And that is something that is prescribed by me. It's almost like me prescribing a medication. I'm prescribing the training. And so some insurance policies will cover that training side of things directed by a veterinary behaviorist. Doesn't always work out for training that is done outside of our facility, but I've had some that have been covered and some that haven't. So it does depend. So I think that's a big question of what does your policy cover or not cover? And I think big sticking point is that sort of pre-existing condition clause, if you will.
So some questions that are more medically related. Can you talk a little bit about the difference between pica, when dogs are eating non-food items like drywall, things like that, and when dogs are doing things, kind of that level of destruction, destroying drywall and things in the home for other reasons, kind of how do you, what's the cause behind them? How do you know the difference? When do you need to seek help?
Sure thing. So I would say if I'm thinking of a dog is eating things, if we say more broadly, eating things that are non-food items, non-nutritive items, I am probably going to say, medical until proven otherwise. So let's go down that medical rabbit hole to see what's going on. That might say look like running more general blood work to make sure that there's not something that is generally going on to make that dog feel uncomfortable. I'm going to want to do a physical exam, a neurologic exam, and an orthopedic exam because there are reports that some dogs have in the past actually been eating rocks because they are uncomfortable. So it is a way that makes them sort of, hate to say it this way, but feel a little bit better. And so primary pain concern. I might also look for a primary GI concern. So do you have something like stomach ulcers, IBD or IBS, something of that nature? I would want to rule out a primary medical concern first. If all of that comes back as potentially normal, or if there are other inklings that tell me, ooh, there's an anxiety component here. Maybe that's not this dog's only problem, or maybe it is only happening at certain times, then we go down the anxiety rabbit hole, the behavior rabbit hole. And so in that sense, I might say, when is it happening? And so that's that question of, is there an anxiety component that's coming in? So is it happening when we are, say, leaving that dog home alone? Is there a separation anxiety component there? So I probably want to have a video camera up to see what that might potentially look like. And so in bringing that medical and behavior causes together, we might be looking into a primary medical problem while treating stress and anxiety at the same time. I certainly have dogs that will say, chew on things to sort of self-soothe to help manage that stress and anxiety. I have some dogs, for lack of a better term, that might chew on things, destroy things out of, say, frustration, arousal, agitation. So it's helpful to know what those might look like. Again, that's where videos come in. That's where context comes in. And we might say, is that dog getting enough mental enrichment to help manage those needs? Are we as pet parents meeting those needs for that dog? And if not, is the simple solution to meet those needs a bit better? And maybe we don't need to go down the behavior medication rabbit hole. Maybe we don't need to go down the other medical problem rabbit hole that way. So pica, definitely an interesting diagnosis that has a lot of different things that we have to think of for sure.
Let's see. Someone asked, and you already answered this, but what types of anxiety medications exist and how do you pick one? You answered that. But the reason behind that was their dog had been on some anxiety meds and almost died, so worried about trying again. So I guess we can generalize the question as, are there alternatives that affect anxiety in different ways that would not cause the same kind of issue? And maybe what are some of the symptoms that an owner should look out for that indicate that they need to contact their vet right away?
To answer that question very generally, yes, there are different medications that affect different receptors, transporters, neurotransmitter systems. So I will think of it as just like, say, myself or any other human on this planet, we might respond differently to a medication, and we won't know until we try that medication. Our dogs are the same way. So we can speak in generalities of, yes, it should not cause a major side effect, or, God forbid, should not cause a harmful experience to a pet, but we won't know until that happens. And when I think about side effects and side effect profiles, I am always looking at the dog in front of me, what their behavior concerns are, maybe what their medical concerns are, and then I'm forming a medication plan based on what that looks like. So thinking about, there are some medications that affect appetite more than others. If I have a dog whose appetite is not great to begin with, or maybe they have GI concerns, vomiting, diarrhea, that type of thing, I might specifically pick a medication that does not have that side effect profile. If I have a dog with heart disease, there are medications that I am not allowed to use because it is specifically on the label for that medication, should not be used with various heart disease or seizure conditions or glaucoma and other on the label claims that you may not use it. I have some dogs that might respond poorly to a specific type of medication, and then I don't use that type of medication if I can get away with it. I also have some dogs that might respond poorly to medication A in a class of medication, but they respond fine to medication B or medication C because there's an alternative in the way that that medication works within that specific dog's body system. There might also be differences in, say, how medications work in combination together. You might have your daily medication that you're adding something onto, and that goes horribly, horribly wrong. And you say, let's pick something else. And that goes supremely well. So it can be a bit of trial and error to find what works best for that dog and for that family. I will usually say broad strokes. More challenging behavior concerns or cases that I manage are those dogs that don't read the medication rulebook. If we are having to search through medication after medication after medication to find that one that works well, that can be harder and harder to manage a behavior concern because our options become more limited. Those are my more challenging cases to manage. Second question, as far as if I see a side effect, when do I need to contact my vet right away? So I will say, if I see a decrease in appetite, if I see profound sleepiness, sedation, lethargy, and that usually looks like my dog is just sitting on the couch like a couch potato, and I ask if they want to go on a WALK and they could care less, I don't want to see those side effects. So that is a contact me because I want to change the dose, or your primary care vet because I want to change that dose. Certainly, if there's any sort of vomiting, loose stool, diarrhea, profound decrease in appetite, you're going to want to contact a vet sooner rather than later because we don't want that to go on. Bigger concerns, and I think this is where we're maybe getting into that realm of question, we hear of that dreaded serotonin syndrome. So that is where we have too much serotonin in our system. That's one of our primary neurotransmitters that we target. That can look like a wide variety of different things. That can look like increased salivation, vomiting, nausea, increased heart rate. That could feel like increased rate of breathing. That could look like, say, muscle tremors or seizures. Is that a solitary muscle group? I've had one dog that had that as a side effect, that the muscles in its face started tremoring. I've had other dogs that have had too much serotonin where they've had what looks like seizures or increased temperature. There are reports that could look like even, say, coma or death. Scary, I know, but those are usually dogs that have unfortunately gotten into their medication, their owner's medication. Should not see anything like that at our normal, typical behavior modifying doses. These are usually dogs that have eaten an entire bottle of medication and they are getting 10 or 100 times that dose. They need to go to the emergency vet right away.
This person has a dog that has episodes that are triggered by overexcitement, a sound, or nothing. So hard to pinpoint triggers.
Sure.
When they react, it's vicious, involves aggressive biting, lunging, spinning, barking, and biting. Apparently the episodes are always directed at a tree, so a single kind of object.
Okay.
They can be stopped and don't respond to phenobarbital. So she's wondering if it's a seizure or heart attack. So I guess the generalized question is, how do you differentiate between panic, aggression, and seizure disorders?
Mhm.
And are there symptoms that an owner can use to either kind of help them figure out which it is, or are best to report to their vet to help best aid in diagnosing it?
And I think I will say this, broad strokes. These are some of the more challenging things to diagnose because we as pet parents are looking at it, and even as veterinarians, we're looking at it and saying, what's going on there? What exactly is happening there? So I would say big things that I think of if we're talking about and I'll put it in quotes here, typical seizure. Usually that is an episode, an incident, if you will, where that dog is, say, not mentally present. So they are not conscious of what's happening there in a typical seizure. They usually will have some sort of motor component. So we think about, say, like legs paddling is what common thing that we might think there. And they might, say, lose control of their bladder or their stool, their colon. And so we might have, say, elimination there. Typically, after a seizure, dogs are usually not themselves. So they take time to recover. So that's what we might call a post-ictal period. Their nervous system is recovering. That is typically what and I say typical seizure looks like. I have some dogs that have seizures that do not fit that bill. So we might think of what's called a psychomotor seizure, where they are mentally present, but they might, say, wake up from sleep and have aggression concerns, or they might have an interaction that causes an aggression concern. And so that does not look like your typical seizure. It can look very different. They are not paddling, they are not eliminating, they look mentally present. And so that can be where you get a bit in the weeds. Unfortunately, that comes with two different trials, a anti-seizure medication trial and a behavior medication trial. And that's usually where you're working in concert with a behaviorist and a veterinary neurologist. I think if there are ways that we can pinpoint triggers to more key them into this is what causes it, this is what we see in and around it, and it seems more like, say, body language looks like fear and anxiety, or if there is a specific trigger in a specific context that consistently causes that aggression concern, I might think more along the lines of behavior. But I'll tell you, these are my more challenging cases to manage because it is not so clear cut. It is not a dog with separation anxiety that's panicking when an owner leaves. These can be a little bit more muddy, that take a bit of trial and error to figure out what's going on, and sometimes involves a couple of specialists to figure out that answer.
We've got a question about anxiety related to gastro problems. So, what might a pet owner do at home to address some symptoms with gastro disorders? How do we recognize them? And when should we contact a primary care vet? And when do you need to go on to veterinary behaviorists when you've got this?
I think about my gastrointestinal problems in a couple of different ways. So general things that we might think of. Is a dog's appetite changed? Is it increased or is it decreased? Things that I might describe to pet parents. Do they seem excited to eat breakfast, dinner, snacks, but then they go up to that bowl and they say, "Ugh, I don't want that anymore"? Do I have other dogs that might present as nausea, actual vomiting that's happening? Or might we have, say, regurgitation, bringing up undigested food that doesn't have that sort of irpy vomit component where they're actually physically bringing something up? We also have to think about the different components that interact with the GI tract. So simply, you've got your stomach ulcers, maybe infection, inflammation. You have your intestines that could have any and all of those things. So small intestine, large intestine. Think about who also communicates with the GI tract. Your pancreas, your liver, your gallbladder. All of these things can come into play to have an effect on that. So that is certainly where doing some baseline diagnostics to make sure that everyone is playing well together and working in tip-top shape can be helpful. Sometimes we can bring that potential pain component into play. So if we think of ourselves, humans, as maybe you're having an unhappy gut day and your intestines are cramping. I certainly do not want to make dinner when my intestines do not feel the greatest, so I might be a bit more irritable. Our dogs can have that same thing happen. So maybe is it that irritability is being caused by gut discomfort, and I wouldn't treat that with an anxiety medication, but I might treat it with a pain medication. Or I might say, what is causing that pain and discomfort? So then we go along the route of, is it a primary GI concern? And that can look like a gamut of different things. Is that, say, pain medicine? Is that antacids? Is that anti-nausea medication? Is that a diet trial? Do you have allergies or do you have intolerances? So we need to remove certain proteins or foods from your diet, and we need to treat it in that fashion. I will tell you, there's a fair number of dogs that come to me that I will say, talk to me about their appetite. And they tell me all of these things, and I say, I might want to work something like this up while I am also treating your primary behavior concern, because there's a component of medical that we have not treated yet. Sometimes it can be related to, say, infection. So is that bacterial infection? Is that intestinal parasite infection? That type of thing as well. It can also come down to gut microbiome. I feel like that is a bigger term that is coming in and around the behavior realm for dogs and also humans as well. So if your intestinal microflora or fauna, your gut microbiome, are not happy and healthy and getting you the nutrients that you need, that might be that first line of defense that we need to modify. So I would say not necessarily something that I could say blanket statement, this is what you can do at home. You see how complicated that is. But I think if we have a dog that is consistently nauseous, vomiting, regurgitating, having consistently loose stool, or has a consistently low appetite, I would say those are any and all spaces to talk to your primary care vet about it. If your primary care vet is not one that jumps into, let's figure out what's going on, that might be a question of, do I go to an internal medicine specialist? So can they work up that gastrointestinal component? Sure thing. That might be my stop before they come to see me as a veterinary behaviorist, because I'm probably going to say, go to the internist to have this worked up if you're coming to me and I need that further step.
Okay, so here's a kind of a related question. First of all would be, I personally get a lot of clients whose dogs are on prescription diets, and the question is always, my dog hates it, how do you make it more palatable? The second question is, what can you use for training other than treats?
So let's think about that that palatability question. And I will say it, I get it. I think some of our hypoallergenic foods, I usually describe them as like air puffed cereal. They don't taste great. And I completely get that. So I might say, and again, depends upon what your dog is allergic or intolerant to, that might potentially further limit us. So broad strokes, I might say, can we take that food item, so thinking of a dry kibble, and change the consistency of it? So is that a take your dry kibble, pulse it in a blender, and make something that is maybe a little bit of liquid added to it, so water, make a different consistency, and do I put it in a squeeze tube or a squeeze pouch? Is that different enough for my dog to say, oh, I'll buy into that, I'm okay with that? I might say, if this is something that is going to be a challenge for you and your pet, do you have that conversation with your vet to say, what are my options? If it's only a dry kibble, and say there's another option that has dry kibble and wet food, go for the dry kibble and wet food, because I mean, wet food opens up to anything. Can you use wet food sort of watered down as that squeeze tube option? Sure thing. Can you make your own treats from wet food and say, dehydrate it in the oven? Sure thing. Can you freeze wet food into like tiny little, nibble bites that way? Sure thing. So that can potentially be an option. We can also think about most allergies, intolerances are more often than not due to a specific protein or a specific ingredient. So I have some dogs that are unable to have various meats or proteins, but they're welcome to have nuts, nut butters, various yogurts that don't have, say, like cow or milk ingredients in them. Are there fruits and veggies that are options? Fruits and veggies do not have meat proteins in them. So that gives us an option. I also tell my pet parents, if we're talking about, say, vegetables, a raw sweet potato feels different than a pureed sweet potato, than a frozen sweet potato. So it might be consistency that your dog prefers or does not prefer. Do they want it cooked? Then cook it for them. Do they want it pureed and raw? Then do that. I will think about those as some different, some alternative options that way, especially if we are a bit more limited. Now, if you get into the more, say, novel protein diet, so a protein that your dog has never seen, that might open up our options a bit more. So they might be, say, not able to eat pork, beef, chicken, but have they ever had rabbit? Have they ever had lamb? Have they ever had kangaroo, alligator? There's so many different novel proteins that are out there. That might be a conversation that is worthwhile to have, especially with your primary care vet, to say, we are stuck. What can we use? I have some folks that have used marshmallows for dogs that have allergies because they are able to eat them. The fluff is sometimes helpful. Does get a little bit sticky on your fingers when you're reaching into your treat pouch, but it's sometimes an option. I will always say, before you start to bring in new or different food items or treats, always talk to your vet to make sure it's okay first. Because I would hate to say, you can do any of these things, and then have your vet say, yeah, absolutely not. That's going to completely mess with our diet trial. To that question of, what if my dog is not food motivated? What can we use other than treats? First and foremost, if your dog is not food motivated, think about why they might not be food motivated. Think back to our conversation of GI disease. Is there a reason why they do not want to take that food? Does their belly hurt? Might they say, yeah, I'm not eating that. My belly doesn't feel good. Why ever would I take a treat if my belly doesn't feel good? I might also think about, are they not food motivated because they are not motivated to take a treat in that training session that we are doing? Are they too close to a trigger? Are there too many distractions? Might they say, you can have filet mignon in your pocket and I am not going to take it because that truck just whizzed by me? It does not matter what I have in my treat pouch. If there is a trigger that is too close, too much, too fast, a dog is going to say, nope, not eating. If we ruled out all of those things and your dog does truly prefer something else that isn't food, that can be a wide gamut of different things. That could be they want to engage in toy play. Maybe they want to have a small tug session as a reinforcer. Might they want, say, petting, human contact, engagement that way? Might they say want as a reinforcer, distance? Move me away from that trigger, and that can be reinforcing for me. Might they say want access? So thinking of, can I let my dog out into the yard? And that is reinforcing for them. So various different options, but think about how we might be using those other reinforcers. If I've got a dog that is already emotionally over aroused and over threshold, I might not want to bring a toy out that pushes them further over that threshold. If I have a dog that maybe doesn't enjoy being touched by their humans in their life, they're not going to find something like that as reinforcing. So thinking about what those different reinforcers look like and feel like for your dog, you might find that there's something that you haven't tried yet that is maybe a bit more reinforcing, but it hasn't crossed your mind to use it just yet?
So quick question on, are most veterinarians trained in treating Cushing's disease, or do you need a specialist?
I will say that general knowledge, yes, we all learn that in veterinary school. So it's in our more general internal medicine classes, yes. Not every primary care veterinarian might be comfortable, say, diagnosing it or treating it. So some might refer to an internist to be able to do that. But yes, we all get that general knowledge in veterinary school, sure thing.
All right, so assuming there are not guarantees for results, which obviously there won't be, what is the typical success rate with veterinary behaviorist work?
So I'm going to take that question and turn it a little bit, because success might look like something that is different for every single person. So that's where I would say in my consultations, I'm going to ask what your goals are and what success might look like for you. Someone might say, I just want to be able to leave the house for a quick errand for 5 minutes. That looks very different than, say, somebody who needs to have an entire workday where they are able to leave the house. Some folks might say, success for me is my dog's not showing aggression to each other. And if that means I have to completely separate them lifelong, I will do that. Some people might say, Dr. Ropski, that is not feasible for me and in my household. I cannot live with my dogs separated, or my dogs cannot live being separated, or there is not a space where I can put up a baby gate, a barrier, what have you. So differing levels of success are going to depend upon what that looks like for you. There are also varying levels of success based on what my pet parents are able to do and not able to do. You can imagine those folks that can institute a treatment plan to a T, do all of the medication or management strategies. They are probably going to be more successful than, say, someone who looks at that treatment plan and says, yeah, I can do one of those things and that's it. We're probably going to be less successful if that treatment plan is complicated and my pet parents are not able to do all of those things. Does that mean that we are unsuccessful? No, but there's varying levels of success. More often than not, I at least try to gauge prognosis for my pets the best that I can at that first initial appointment. I will say more often than not, if I'm rating you on a scale of 1 to 10, many of my families fall into that middle of the road. You're not doing amazingly because you're meeting me and we need some help, but you're maybe not doing so poorly that we're talking about, gosh, rehoming, relinquishing, or euthanizing the dog in front of me. And then at each subsequent yearly recheck with me, we are gauging that dog's success. I will say more often than not, the majority of my patients will move from, say, that middle of the road, 5, 6, and a year later, my pet parents are rating them as a 6 or a 7, or maybe an 8. I will say it's usually rare that my pets get to a 9 or a 10. Everything is perfect, but I have some pet parents that will rate their dogs as a 10 to say, we were a 3 when we started. We are a 10 now because Fluffy is doing so much better now, and we are successful. It is sustainable. So those are things that I might think of as not necessarily what is the percentage of success rate, but is what we are doing sustainable for you and your pet longer term.
So, person with a 3-year-old dog who's having working on positive training to get over fear of new things, having some success, but what that person's wondering is, will they eventually overcome their fears, or will they continue to have it their whole life?
Just as we said that there are no guarantees, we don't necessarily have the ability to, and I'll put it in quotes, cure aggression, anxiety, fear, stress. I don't have the ability to say, here is the perfect treatment plan. Your dog will never experience this ever again, because it's a normal behavior to have. Aggression is unfortunately normal communication for our dogs. To have some level of self-preservation is normal for our dogs and for our humans. But what I will say is my goal to manage those behaviors to the point that this dog in front of me's quality of life is good? And is the human in front of me, is their quality of life good? So we might have those instances where 90% of the time they are doing great, 10% of the time they might require additional management. Those numbers are made up. That is not what my goal is, but that idea of, for the majority of this dog's day-to-day life, are they doing well? Is their quality of life good? Is it sustainable longer term? So there are things that come into play that we have absolutely no control over, that we cannot change. And so our big focus should be on what we can indeed change now for everyone's quality of life.
Okay, so this one, how do you know when it's best to rehome versus starting with a veterinary behaviorist? And I'm going to add in there rehoming versus euthanasia versus working with a veterinary behaviorist, because that's another common question.
I will say that dogs with behavior concerns are challenging to rehome, especially dogs with, say, aggression. So it is challenging to find another home that does not have the triggers that that dog experiences that could cause, say, that behavior concern. It can be challenging to find a rescue or shelter that has the resources to manage that dog with behavior concerns. And is it appropriate to ask someone else to take on those behavior concerns? A lot of times when folks come and reach me and are talking about rehoming their dog, and they have gone to the ends of the earth to help this dog be successful, I will often have to say or think of, do you think there is someone else out there that is going to do a better job at this than you already are doing? And if they say, well, no, I'm doing the best job that I can expect of anyone, then I might say, is there truly a home that is out there that this dog could be successful in? Now, that being said, certainly, are there homes out there where if a dog is aggressive to children, could you find a home without children? Definitely. If a dog has very specific triggers, could you find a home that maybe doesn't have those triggers? It's possible, but it's fewer and farther between. When I think about that conversation of, do you come to me, or do you think about that rehoming or euthanasia conversation, some folks want to talk that out with someone like me who has that additional knowledge, maybe beyond their primary care veterinarian. I will tell you, there are primary care veterinarians out there that will not or are not comfortable euthanizing a dog with behavior concerns, regardless of how bad that aggression is, regardless of how poor that quality of life is. They will not do it. And that is when some folks will come to me to say, Dr. Ropski, our dog is suffering. We, as the humans in their life, are also suffering. This is not fair to them. This is not fair to us. There is not a home where they could be successful. And then we are talking about having that very difficult conversation. When I think about euthanasia for behavior concerns, I will often say that the brain is an organ just like any other. If your dog had liver disease and we had done all of the things to try to treat your dog's liver disease and we were unable to, and they still showed signs of that disease and we were unsuccessful in our treatment process, we would consider euthanizing them when their quality of life is poor. The brain is no different. If we have done all of the things that we can do reasonably to help our dog to be successful, and they are still showing substantial fear, that's a safety concern, or aggression, that's a safety concern, or anxiety, any of those things that are impairing this dog's quality of life, that is when we will say, is this fair for this dog? Is this fair for this human that's in front of me? And if that answer is no, their suffering is too great, then we do talk about that difficult, but that euthanasia topic. I will say more often than not, we are talking about that for my patients for severe and substantial aggression concerns, because it becomes a safety concern, not only for this dog, but for the people in that dog's life. And that is not fair to anyone to continue to muddle on if everyone's quality of life is poor?
That's such a difficult decision, but that was such a great answer. So this is a great question too. Can adding a confident dog to a home with a fearful or anxious dog help the fearful situation?
I get this question a lot too. It depends. And it stinks to say it that way, but it truly does depend. I also get this question for if my dog has separation anxiety, does adding a second dog to the household fix the problem? So I have had it that some dogs that are fearful that will experience greater confidence, less fear when there is another dog around. I have had it. It is fewer and farther between. I can name on one hand, I'm thinking of maybe two of my clients that it has actually helped. Unfortunately, one of them had some resource guarding concerns when we added a second dog into the household. So helped with the confidence and the fear, but added in another issue that they had to manage. For separation anxiety, I find that it is less helpful to add a secondary dog because we have to think of who that primary attachment figure is. It's a human. It's not a dog, and that dog does not take the place of the human when they are left alone. So sometimes that can be a conversation where we say, instead of go out and find another dog to add to your household, might we think of, say, fostering a dog? Do we do a foster to adopt potential scenario where we say, is it any dog that can fill that role? Or can we find a dog that helps dog A to be more successful, and say, what does that look like? Many times I will caution my pet parents to say, it is not always the answer. And sometimes you arrive with now 2 problem children as opposed to just 1 problem child. So there's a lot of variability there that it's hard to say, yes, bring another dog into the scenario.
Let's see. What is your advice with the relationship between behavior and underlying pain and medical issues? And what are your thoughts on getting a pain med trial to see if it helps?
I say go for it. We have a paper that looks at the connection between pain and behavior concerns. So it is one that a variety of veterinary behaviorists have weighed in on. They are all authors on that paper. It is written by Dr. Mills and his group. In that paper, they reported that between 20 and 80% of their caseloads, they saw pain and discomfort as a reason for behavior concerns. I would say that in my practice, I'm not close to that 80% threshold. I'm probably in that lower threshold, but I think it's the cases that are being sent to me because my primary care veterinarians in the area, they're pretty astute. They're doing pain trials before dogs even get to me. But I will say, example, very general, but I had a dog that presented to me for an acute behavior change. They were terrified of going outside. And I said, well, what's happening? What do we have to do to go outside? Oh, they have to use the stairs to get outside and go off of the deck. This dog presented to me with what I would describe as a lowered head carriage. So instead of carrying their head up this way, they were sitting with their head hunched. I got neck pain on exam and had our neurologist look at that dog, and we did an MRI and we found a disc. So intervertebral disc disease that was causing pain, that caused a behavior concern. So it wasn't me. This dog didn't need anxiety medication. It needed pain medication. And so I will always say pain, medical concerns, acute behavior change is medical until proven otherwise. If we have something that is very abrupt, very fast, I am going to say, go find that medical concern. I am all for doing pain trials to rule in or out medical concerns because pain inherently causes irritability. Pain and discomfort causes our dogs to have shorter fuses. So we might see that a behavior concern is certainly caused and due to irritability and discomfort. And our dogs might not always be able to tell us, this right here, my shoulder hurts. This is where the problem is. Or they are afraid and anxious on their exam. So they're going to sit as this tight, wound up little ball, and they're not going to say, right here, this is where it hurts. So sometimes a pain trial at home, away from the veterinary hospital, can be the way to tell us, yes, there's a difference or not. And I think that's where video comes into play, because I might say, take a video before we start the pain trial. Now take a video after, send that to me, and I can look at and see if there are differences in, say, that dog's gait or that dog's mobility. So I say 100% yes, if it is safe for that dog, why not do a pain trial to see if there is a reason for that behavior change? Sure thing.
Excellent. And I have one last question.
Yeah.
You mentioned cooperative care for the vet or the vet office.
Yeah.
If a person has been told that their dog didn't do well in a vet visit, maybe needs a muzzle or something like that, or if they don't have a fear-free vet near them who's going to ask those questions, how do you recommend that people go kind of address or go in and talk to their vet about how to set their dog up for success? How, you need to go slow. I've been working on this. Could you give me pre-visit meds, something like that? What's the best approach for asking your vet about that stuff?
So it can be helpful to bring it up, maybe even when you're scheduling your appointment, so that your vet knows what they're walking into. The way that I could bring something like that up is the picture that I showed you all of Sadie at the vet hospital that is not mine. I preface that conversation with, Sadie does better when I am present at the vet. This was COVID. I was not allowed to go into the practice that we normally go to. So I advocated for her, saying, she does better when I am present. Are you all able to accommodate that? Great. I will bring these things. This is what helps her to be successful. So it doesn't do any harm to ask and to bring it up, because the worst case scenario is they say no. And if they say no and they cannot accommodate you or your pet's needs, maybe that's not the best veterinarian for you. Because if you are identifying stress and anxiety in your pet and your vet or their staff maybe isn't seeing it, I would say that no amount of you advocating is going to make them see that if they are not recognizing it themselves. And so maybe we have to think about a different vet in that scenario. But you advocating for your pet and saying, this is what maybe we've been working on. We've been working on muzzle training. We're not there yet, but I would like to be able to have some more time to work on that muzzle. Can we potentially delay whatever the service is, a vaccine or a blood draw or something like that? If I was your vet, I would say, heck yes. I think there's also something that being said in a fashion of, if something doesn't go well, being able to stop and say, Fluffy is over threshold, let's reschedule. And being understanding that if we are going slow and taking our time, maybe we can't do an exam, a blood draw, and 4 vaccines all at once. So maybe we break up those visits, and we are understanding pet parents to say, great, I get it, blood draw and 2 vaccines, that's all we can do. When can we schedule the next 2 vaccines? Or understanding that a nail trim, pretty scary for a lot of my dogs. A nail trim is a want, not a need. So if your vet says Fluffy is too scared to have a nail trim, let's talk about what that could look like next time. Here are some medications to help your dog to be successful, being understanding that they are doing that for a good reason. That is a green flag, not a red flag. When a vet says, we cannot accomplish this today because of your dog's mental health, and I want to preserve that. That is a green flag, not a red flag.
This has been an absolutely amazing webinar. With that, I will say thank you again to Dr. Ropski, and have a wonderful afternoon, everyone.
You guys are so welcome. Bye now. Thank you so much for coming.